Good morning to one and all. I am Athira A, Assistant Professor, Department of Pharmaceutics, National College of Pharmacy, Kerala. So here I am going to discuss about prescription. So the contents includes the introduction of prescription, its parts and its types, and the legal requirements mainly required for the prescription. So first of all, prescription. So prescription is an written order by physician, dentist, veterinarian or a registered medical practitioner to a pharmacist to compound and dispense a specific drug for the patient. So prescription is something that is a relationship between the physician and pharmacist. So the word prescription is derived from the Latin term prescriptus. As a pre just means before and scriber which means to write. So prescription is something just means to write before, which is to be written by a drug could be compounded and administered to the patient. Okay, so the various parts of the prescriptions. So the prescription usually consisting of the following parts. First of all, the prescriber offers information, following the date, then the patient informations, which comprises of the name, age, sex and address of the patient, following superscription, then inscription, subscription, signature or transcription, following the renewal of the instructions, following the prescriber's signature and registration number. These are all the parts that comprises the parts of the prescription. Okay, the first part is the physician or prescriber office information. So in a typical prescription, usually consisting of all these informations, just that the doctor's or office name, the address with phone number and email and the prescription number. Okay, following the date. So the date, the relevance of the date in the prescription is such that it will help pharmacists to find out the rate of prescribing. So it also helps to know when the medicines were last dispensed, especially in case of the drugs which usually belongs to XRX, NRX basis. So the date is very relevant. Okay, also especially in case of the habit-forming drugs, dates prevents of the misuse of the drug by the patient. So next is the patient information. So the patient information requires or comprises of the name, age, sex and address of the patient. So we also already know that the age is very relevant in case of dose calculation, especially in case of pediatric dose calculations. As the pediatric and geriatric dose calculations, the age is very relevant as those may vary according to this. Okay, so name and address of the patient is for the identification purpose, and age and sex of the patients are required for the child patient and especially the pediatric and geriatric patients to check the prescribed dose and to calculate accordingly. Okay, so next part is the superscription. Superscription or symbol that is usually denoted by RX. Okay, it is represented by RX, that is Latin term, which recipe, which means take though you take. In olden days, the symbol was considered as being originated from the sign of Jupiter, as Jupiter is the Greek god of healing. So it is usually used for, the symbol was used for requesting the god to keep recovery of the patient from the particular disease. So next is inscription, that is the medication prescribed. So it is the most or the main part of the prescription. It actually contains the names and quantities of the prescribed medicaments. The medicaments may be official preparations or non-official preparations. So coming to that, the official preparations, that is official preparation is being the preparation that is being mentioned in the official reference books as like pharmacopoeias. That is the only name of the preparation is written. So in case of the official preparations, only the name will be written, like for example, piperazine citrate elixir IP, because the piperazine citrate elixir is one of the hydroalcohol formulation that is being mentioned in Indian pharmacopoeia. That's IP is the Indian pharmacopoeia. So we need not want to write those ingredients, those belongs to this peculiar formulation. Why? Because as it is being written in the official book or like pharmacopoeias, we need not to write the ingredients. Okay, so coming to next, the non-official preparations. So the quantity of each ingredients will be given and the type of preparations is also given in case of non-official preparations. That is, the ingredients will be listed out with the required quantity. Okay. So next is the subscription. That is, a subscription is a direction to the pharmacist. So in this part, the prescriber gives the directions to the pharmacist regarding the dose to be prepared or the number of dose to be dispensed. So these details will be written in the part that is superscription in the parts of the prescription. Okay. So next is SIGNATURA, that is direction to the patient. So this is the direction to the patients that is should be written in the label. Okay, the formulation is being filled in various containers or syrups according to the formulation which it is. So that according to that, so what are the directions to be written in the label is being explained in the part that is a SIGNATURA. So it is usually written as SIG. Okay. So next, the instructions will be such that the quantity to be taken, such that the dose of the drug to be taken at each time by the patient. Okay, the frequency of administering the peculiar preparation. So we also know that the drug to be taken twice a day, thrice a day, like what? The instructions and frequency and the route of administration. We know the route of administration. There is various kind of routes like oral, transdermal. So so if it is insulin-like preparations, SC, that's a subcutaneous administration. All these. So it also all this contains the instructions. And also if there is any special instructions, if any, to be administered, especially if we know that the certain pediatric syrups, that is antibiotic syrups, are available in the dried form. So just before administration, we want to reconstitute it with the water for distillation or the water that is being provided along with the dried syrup. Just before administration, we want to mix this water for injection with with the dried syrup. After that, the consumption. So that is, if there is any special instructions, it should be clearly written further. So next, renewal of the instructions. So the number of times of prescriptions to be updates should be given. So it is very important in case of renewal of instructions until the next time the patient want to meet the prescriber. Okay, so next is the prescriber's signature and registration number. This part is very important because in order to show the prescriber, so that's a prescriber signature and its registration number is also very important. Okay. So next is the type of prescriptions. So the prescriptions can be classified as the compounded prescription and non-compounded prescription. Okay, so first one is the compounded prescription, which is also known as extemporaneous preparations. So it is an order that is mixing of one or more ingredients. So it usually consisting of a certain following ingredients, like there will be a base. What do you mean by this base? Base is an active medicament which usually produces the therapeutic effect. Along with the base, that is an active therapeutic moiety or the drug, there will be additives. That is, what the use of additives is like in order to enhance the action of the drugs or in order to enhance the palatability of the drugs. Because certain drugs, most of the drugs are nauseous in taste. So in order to mask that, we can add flavoring agents, like in order to colored agents, all these things will be included. Okay. So next is it also masks the unpleasant taste as we discussed. So there will be also a carrier of the drug, that is a vehicle. So the solvent. If it is a solvent or solution type preparation, there will be a solvent, that's a vehicle. Mostly water is being used as a vehicle. Okay. Okay. So next example is the sodium bicarbonate 3 gram simple syrup. That is the sodium bicarbonate 3 gram is being prepared in simple syrup and purified water. So next is the non-compounded prescription. It does not require compounding of the pharmaceutical product because pharmaceutical company itself have the official proprietary name for the same thing. So we do not want to compound the same thing. Okay. So the prescription. So what are the legal requirements for a valid prescription? The prescription should be written in intelligible, that is a form, and also prescription must be signed by the prescriber, registered medical practitioner. It should be dated. It should be properly monitored. Okay, all these things to be considered. Okay, so it is the writings should be legible. So we should be avoided the abbreviations and complications. So that's all about the parts of the prescription along with its legal requirements. So thank you.
Okay. Ang mga ito, record